I am from Italy, from Associazione Palinuro, which is the only association of patients in Italy with bladder cancer and treating about urothelial cancer in general. And I want to talk to you today about our first experience with the walk in Italy. It was named Stop at Red Walk 2024. Bladder Cancer Awareness Rising Walk. And you see the finish line here, but what I want to explain you is that on May 12th of this year, for the first time since our association of bladder cancer patients was born in Italy in March 14, 10 years ago, we organized the first march. To be exact, we named Walk a Free Step. And we were stimulated to undertake this activity, especially after attending one of the meetings organized by the World Bladder Cancer Patient Coalition as part of the members' capacity building project, which was just about organizing an awareness work. It was very, very interesting for us to understand how to do this experience, and we decided to try to have the first walk also in Italy. And also because really it was the 10th anniversary for us, so we desired to have a special event for this anniversary. Our association has 400 members and 52 trained volunteers, and we are in 23 hospitals with our volunteers. Just to let you know that in Italy we have 30,000 new cases per year, mainly men over 50 years old, but the percentage of women, as in other parts of the world, is increasing. The number of Italians living with a diagnosis of urothelial carcinoma, you can see, and the impact on quality of life and life expectancy is significant and often dramatic. It's over 5,000 deaths every year. And you know, there is no finish line without a goal, without an objective. And which are our goal, our objective? For sure, it's we share a world without bladder cancer. And we want guarigion, we want a cure. And we desire the bladder preservation. So we started in 2022 with our first Stop at Red event. We launched this campaign with a video spot reminding all citizens of the importance of not underestimating any warning signs and consulting a doctor for early diagnosis and timely access to the most appropriate treatment strategies. A signal correctly interpreted makes an unexpected turn in a man's day and could perhaps change the course of his life. This is the short, just to understand the sense of the video. This campaign reached about 2.5 million target users through Palinuro social channels and was amplified by national media activities with a readership of over 10 million. In 2023, we presented the video spot at the major national film festival, amplified the campaign's reach, bringing its prevention message beyond the traditional healthcare information channels. The video was also awarded as the best health awareness and prevention spot at two of these prestigious festivals, the Biopic Festival and Catania Film Festival. And in 2024, Yeah. So we have set the ambitious goal of engaging and involving people, particularly the citizens of our city, Milan, in the Stop and Red Walk, free walking event against bladder cancer, a non-competitive walk promoted by Palinuro to emphasize the importance of information and prevention in the fight against bladder cancer. So this was Fermati Rosso Walk logo. As you know, May is Worldwide Bladder Cancer Awareness Month, a cancer for which at present there is no possibility of prevention and early diagnosis through recognizing the symptoms is the only way to limit the damage caused by the disease. And blood in urine is the most important symptoms. So enjoying its city, being together while paying attention to physical fitness, but also sending a real signal about the existence of this problem. There are so many. Yes, we are here too. And if we are here, it's to make healthy people aware that a serious illness can come just when you least expect it. That's why it's important to recognize the signs. And we arrived at the finish line after passing by many traffic lights and near 3 of the 7 hospitals in Milan where Palinuro is present with its volunteers. And this result can be achieved through the combined efforts of the teams of Palinuro, but also of the sponsor and the agency supporting us. But there were also some problems. In a city like Milan, the organizational difficulties were not few. The permits, which had to be paid for, the viability, the paid permission for sponsor brands that represented advertisements, and we also had to solve big problems with the supporting organization agency that had quoted disproportionate costs for gazebos, sales, personnel costs. So we decided all on the road part of the organization we did on our own with the strength and cooperation of our volunteers. And this is our team. Okay. A photo of the people who helped us in organizing all the necessary aspects of the work. And another important milestone was that we had the collaboration of the doctors. And so we was all together in this event to raise public awareness about recognizing the symptoms and early diagnosis of bladder cancer. And this is the finish of our experience, and thank you very much.
Unfortunately, I'm able to why she recorded it, and she did a great job. We have a walk in Canada as well, but I'm going to pass it over to Libby.
Okay. Should I speak for 5 minutes? Is everyone happy with 5 minutes? Yes? Okay, I'll start my stopwatch. There we go. Okay, so the general theme today is raising bladder cancer awareness around the globe, and I thought I would give you a quick tutorial on how to raise awareness inside government. So how to hold an awareness event in your local parliament. So the first step, I loved what Laura just said about how the importance of goals and finish lines as well. So you can't have a finish line if you don't have a goal, or you can't have a goal if you don't have a finish line. Anyway, you need those. So the first thing is to define the purpose of your event and the policy objectives. So basically for us, this was only the second time that we'd gone into the Houses of Parliament, into Westminster. So it was just really just to teach people about bladder cancer. So that was our first objective. And our second objective is to push for a national bladder cancer audit. So that is to make sure that every hospital in the country shares its statistics, and then the government creates a report saying this is what every hospital is doing in terms of, say, bladder cancer surgery and treatment, so we can see where the good hospitals are and where the bad hospitals are. It's happening for prostate cancer, it's happening for kidney cancer, but it's not happening for bladder cancer. So that was one of our asks. Another one of our asks was there was, at the time, there was a bill called the Smoking and Vaping Bill, and we were also going to ask all the MPs to make sure that that got passed. So that's what we wanted from the event. Secure a parliamentary sponsor. So find a member of parliament who's willing to be your sponsor and your host. And we're very happy to have Andy McDonald here, who was our MP, and his assistants help us set up all the room. So that is also essential. Select a venue and a date. You can see there, you could see Big Ben there. And so we held our event right next to the Houses of Parliament, and we held it during Bladder Cancer Awareness Month in May. Plan the event agenda. So for us, this was just a drop-in session. So we didn't have a full event. We just had it open for a couple of hours, and members of parliament could just drop in, get a very nice photo that they could share on their social media, and then leave. And then so it was quite an informal event, just a drop-in session. And then invite key stakeholders and prepare participants. We prepared all our participants. Melanie was here as well. So we trained up all of our volunteers and our patients to be ready for the day. And then secure MP attendance. So not only did we we send out through the organising MP, but then we had a lot of volunteers write to their local parliamentary representative and say, I'm in your constituency, I'm one of your constituents, I vote, please drop into this event as well. And that also helped encourage people to go to the event. And then all of the members of parliament got this very nice photo opportunity that they could do as well. And we had little banners so they could say things like, I support bladder cancer. And then it was good for them and it was good for us. And then we also had a printed piece of paper with our policy asks on it. So we had some statistics like this. We highlighted from the World Bladder Cancer Patient Survey some of the issues, for example, around support. And then we had clear calls to action. So inquire about a national bladder cancer audit, push for bladder cancer guidelines, advocate for self-referral pathways, do more to prevent smoking. And so we had templates so we could help them every step of the way, raise a parliamentary question. And then we just followed up after the event as well. So we took the names of the 19 members of parliament who came and spoke to us, and we followed up afterwards and said, this is what you can do. You can raise a question, you can do this and you can do that. And then it also helps as well if you can link that member of parliament with one of your volunteers who actually votes for that member of parliament and lives in that constituency, because then you've also got a little bit of extra power. So so that's what we did. I'm happy to take any questions from the audience a bit later as well. And so now we have Theodorus.
Hello, everyone. So I will try and follow these very nice awareness raising activities that Lydia and Laura have already spoken so far. And I would like to talk about the Bladder Cancer Awareness Month grants that we started in 2022. And their goal was to promote awareness raising activities in low and middle income countries. We have awarded 11 grants so far. And as Alex briefly mentioned yesterday, in the first 2 years, we only got a handful of grants, but this really picked up this year. And we got over 100 applications, which really shows the need and the demand that we have for these grants. So the first one that I would like to mention is from the Blue Pig Center for Women's Health, which launched the Bladder Cancer Niger, Igniting Change and Inspiring Hope campaign, with the ambition of raising bladder cancer awareness and providing more resources for the people in Nigeria. So they reached over 90,000 people through social media activities. They also had several radio programs, and they also wrote many articles online. They also distributed lots of flyers and various posters in many different languages. They also really focused on in-person engagement. So they had over 400 women receiving direct education and information about bladder cancer. So you can imagine that information in general about bladder cancer is low. And then when you add on top that information for women, that's even lower. So that's what they were trying to solve. And they also translate the video in 9 different languages in Nigeria, because there's lots of dialects, so they have to make it really accessible. And lastly, they use the WBCPC's Spot the Drop that we launched this year in their Cancer Prevention Symposium, which they brought together lots of people from various parts of Nigeria. Then the next one is in Ghana, where they had the Bladder Well Nurturing Health and Empowering Lives campaign by Empowerment for Sustainable Livelihood, which of course focused on early detection and support. And the really interesting part, the really interesting activity that they have done is that they organized mobile clinics, providing free screenings to over 500 people in hard to reach areas, and 10% were referred for further evaluation. So this was a really nice activity. And they also did their online campaigns and webinars aiming to increase awareness, where they reached over 10,000 people on social media. And they've also, because of their campaign, this also led to the creation of several new support groups, and which can provide help to 300 individuals. Then we have the activities from Malawi, who is one of our members, Wisdom, who I think is online. So I hope I do a good job at presenting your activities. If not, please send me a message. But they had the Pamodzi campaign by One Community, and they aimed to reach underserved areas with information and support. So they had a really different approach in awareness raising, because they really worked a lot with healthcare workers. They trained 600 volunteers. They visited over 300 households and educating over 700 individuals. And a significant part of the campaign was done through the community and church engagements, which reached over 500,000 people across Malawi, including both Christian and Muslim backgrounds. And they also had live TV spots, radio discussions to talk about, of course, bladder cancer on a large scale, where they reached about 800,000 people worldwide, nationwide, sorry. And this led to the establishment of 21 small bladder cancer patient support groups in various regions of Malawi. And lastly, I'm being really risky today, so I will present what our member from Argentina did, and I see Fiorella taking a picture, so I hope I also do a very good job. Where they had the campaign titled United Bladder Cancer Awareness. And they had, they hosted a virtual symposium with experts providing vital information about the disease. Their Yo Puedo Vos Podés. I'm getting a nod, so I think that's good. Where it created a safe space for patients to share their experience and fostering a supportive environment. They had a really strong social media campaign with daily social media posts, targeted hashtags, and of course, they joined the global campaign that the WBCPC was doing. And they also organized a mindfulness walk at the end of May, giving the participants a moment of reflection and connection. And well, I hope I did well covering the activities to our members. And then I just wanted to say this for the people online and for the people who are here, that we will, of course, be following and making this available in 2025 as part of our bladder cancer awareness activities. How to apply? Well, we're going to have another form on our website, of course. The applications will open in early 2025. And when this goes live, we will, of course, be sharing it on social media. So you will be able to find more information on our website. And that is it. And next, Michelle.
Thank you, Theo and Lydia. And, you know, I go to one and only screen. So what we've been able to do over the last few years is actually light up certain monuments, similar to what Lydia was speaking to with respect to the Parliament buildings. So as many of you may or may not know, we're a vast area of urban and rural centers. And in 2011, I believe it was, one of our board members, who's a volunteer, suggested maybe let's light up Toronto. There's a sign in Toronto that says Toronto, and light up that in yellows and reds as our colors. And he asked one person, and upon the one-to-one, because sometimes, like I mentioned yesterday, you just have to go up to one person and ask. And it was, it turns out that one of our other board members is actually a city worker at Toronto City Hall, and thankfully was able to speak to his boss. We put up the sign and the CN Tower sign there. It's now a Toronto sign that's lit up every year. So we started with just one, just a who do you know? And in my fundraising experience, we always do the who do you know? Your, you know, maybe your hairstylist, or barber, who's your dentist, who's your doctor, and just ask, who do you know that works at City Hall, for example? And that's kind of how we ran this campaign, very organically. So we had the first sign, then we had a sign in Vancouver in the next year. And then last year we had 11 sites, which we were super happy about. So one of the other things I want to add is, in addition to the lighting up, we provide media messaging for them. Because if you go to Toronto City Hall and you see it lit up, the word Toronto lit up, people want to know, oh, why is it purple and green today? Or why is it yellow and red? So we provide messaging. So when you go on the calendar for the City of Toronto, it actually says on May 1, the colors represent this, whether it's an organization or a celebration of some sort. So that, from our perspective, also raises awareness. Because you've got a group of Instagram followers that follow the sign of Toronto, and these folks are international. So when they take a look at today is one certain day or the week is a certain week, they actually are aware of Bladder Cancer Canada, because they're like, oh, that's the sign. Oh, and here's some information on bladder cancer. So last year, as I said, we had 11, which also means there's 11 signs that are lit up that have explanations, and similar groups that follow why is the sign lit up in a certain color. And this year, for the first time, again, it's one volunteer. Who do you know? Who do you know? And now we kicked our own record last year, and we doubled to 22. And we've already got now we've got competing centers. So Edmonton and Calgary, both in Alberta, don't like each other. You know that, oh, we want to one-up each other. So now they're looking at, okay, well, Calgary said we're going to do 2 monuments then in 2025, and Edmonton said 3, and I say awesome. So it's again, it goes back to, and that'll always be kind of where I come from, is I just ask one person and just ask them to share it with one person. And this is how our all volunteer led, all that BCC has done is providing the media key messages to make sure they're consistent across the country. And then we add in one stat about that local province. So, and why bladder cancer is important. So thank you.
Set a timer today so I don't go over time. I think we're already a little over time. Oh. Hmm? Yeah. Are they not in here? Oh, okay. To you and Theo? Yeah. Okay. Now, I'm going to talk about what we did in May 2024 in France. We also had a lucky number, 11 events in May across France. It was a really big increase for us. We had 3 events in 2023. I'm just going to open up my slides on my phone.
Just on your, yes, Lydia, on what you presented, when you provided that, did you also do like an email campaign to the other ministers, members of parliament and so on? Yeah.
We did to a small amount because what we did is we just asked all of our volunteers, we did a template and we said, just write to your local MP. And yeah, so half of it was invite your local representative to come to the event, but then also we had, and then even if they can't come, you know, tell them to make sure that the smoking and vapes bill passes and things like that. So, so we did that as well.
This is in regards to the project in Ghana. Theo said mobile clinics provided free screening for 500 people, 10% referred for further evaluation. Do you know what was involved in those screenings? I'm just interested to know, was it like general bloods? Was it?
Been blood and urine testing, I suppose. Theo might know this exactly, but we can follow up. I don't have a straight answer of the details. Yeah, I think it might be in the full report, so I'll check on in the report. Yeah, but that's a good question, and I think it's amazing though how far they stretched the grant to go and get others on board to do this sort of activity and go around getting people informed and screened as well. So we'll check. We can have a chat about it afterwards. I'll check in the report, and if it's not there, we can ask them definitely.
That's all.
I had a question for Michelle. Was there any cost involved in getting the signs lit up?
No,
Okay.
none. That's where the charitable registration number comes in handy.
Okay.
Yes,
No,
but for corporations, you do have to pay to get
Yeah.
the sign lit up.
We have in the past tried to light up fountains in France, and there's always been some prohibitive cost involved to have the lights done in the colors we wanted. So
Well, that's unfortunate.
Mhm.
No, that's no cost. And actually, it just takes a staff person an hour to write key messages and sends it out to everyone. Yeah. Stephanie's decided to light up her own house. We have it on record. I've also spoken in the microphone. Okay, everyone light up your houses. Challenge accepted.
Christmas lights included. Oh, sell the lights. I hear selling the lights from Lauren in South Africa. We've got a yeah. All right.
Okay.
Bring that. That's the next topic, is how do we fund yellow and red lights? All right.
Yeah, okay, let's see. Yeah, I'll just start with the slides. So we expanded on the activities we were already doing in 2023. Our goal was to go into hospitals, clinics, and have a booth with our awareness materials, and in some cases to have, there we go, to have healthcare professionals present with our volunteers in the hospital, and basically just to talk about bladder cancer symptoms, and hopefully to meet patients. Really, we had, it was kind of a combination of medical professional contacts that we already had in the past. We were invited again in 2024 to the 3 hospitals where we were already present in 2023. And just throughout several months, we made new contacts and had new opportunities. A lot of the contacts we made that allowed us to go into these hospitals and clinics were actually through industry-sponsored events where we were able to meet with urologists and oncologists and have conversations and talk about what we wanted to do. And there was one event I went to where I met somebody from Strasbourg and somebody from Marseille, and that just led to being invited to raise awareness in their hospitals. So, and it kind of all involved, because we started this map, we were posting on our social media. Each time we got a new city, we would update the map. And so then healthcare professionals like, oh, why aren't you coming to our city? And even our members said, well, why didn't you plan to come to our city? And so that gave us new contacts for 2025 as well. So it was really a collective effort, just finding the hospitals where we could go between our board members, industry, and healthcare professionals. And basically the steps involve burning the midnight oil, because the 3 people involved in our organization in putting this all together, we all work full time. And so we were doing this on weekends and late at night. We decided on like a graphic theme for each of our social media posts to keep it all in the same, we just changed the city name and the picture, but we had planned out social media posts because each event was a little different. Sometimes there was actually like a little mini conference involved. Sometimes it was just having a booth. Sometimes healthcare professionals were present, sometimes they weren't. So we just had a little blurb about each event. What took us a long time was to make phone calls and recruit volunteers from our members to be present and man the booths and see where we could send our brochures and our posters and everything ahead of time. Some of the hospitals asked us to sign a contract, which we'd never done before. It was the first time that we signed contracts with hospitals. So that took some administrative time. Just the logistics of sending out the materials, because we had a budget from industry to print posters and tablecloths and different materials. We even had, for one hospital, they asked us to bring a mock-up bladder so that they could actually show what a bladder looked like and what a bladder tumor, where they are and where they're located. So it was a lot of Amazon and Vistaprint and coordinating all that. It was kind of last minute, but we pretty much managed. All of the volunteers, we asked them to agree to a charter, an ethical charter, before they went into the hospitals about how to speak to patients and what they should say and not say. And we asked each of the volunteers to take photos and provide feedback after the event. The challenges we faced were mainly finding the right volunteers, people who were willing to do it, had free time to do it, and who were capable of speaking to media. That was in some of the events, there was media presence, so they had to talk on camera or, have the right information. and minimal training to be able to speak to journalists. It was, we found it challenging to ask, to get our members to share their stories and participate in the events. We actually had, in some cities, we had pretty low turnout among members, even though they live nearby. There's still a lot of taboo, you know, it's different being in a closed private Facebook group and talking about your illness and going out in public and saying, I'm here, I have bladder cancer. That's pretty hard for some people to take that step. And I think we underestimated that. We're always lacking time. If I could just add an extra couple days in every week, that would be fantastic. We ended up having some diplomatic issues because we had invitations to 2 different hospitals in the same city. And that was a little difficult to navigate. But we went to both, but it was hard for us to mobilize our, you know, human resources to do it twice. So we're looking for ideas on how we can manage that better in 2025. Maybe we will have enough funding to rent a neutral location and then invite the people from the 2 hospitals to attend that neutral location. The impact, probably the best impact that we noticed was it was a great opportunity to develop relationships with healthcare professionals, to meet the nurses. That was really important, to be able to give our brochures to the nurses who actually talk to patients and do the follow-up appointments after diagnosis. We have a lot of work to do for 2025 because we've been asked to come back in every single one of the places. And we did notice that there were very few patients actually visited our booths. It was because we weren't necessarily there on the right day. Some hospitals, they have like urology consults on Thursdays, and we were there on a Tuesday. So we had, you know, lung cancer patients saying, oh, I don't care about bladder cancer because I'm here for a different cancer. Even though we were trying to like talk about the symptoms, it was a little difficult. So we need to work on coordinating that better. And so take home message is if you're doing something like this for the first time in your country, don't expect that you're going to reach thousands of patients. We didn't for sure. Definitely plan your media coverage in coordination with the hospital. Many hospitals, they have a public relations department and they'll take over that part for you and plan it out. And we got a lot of media coverage thanks to their expertise, and just plan as far ahead as possible. And just a few pictures of the different places we were, the teams. Some of them we just had like, you know, 2 volunteers. Others we had really big crowds. Every event was different. And that's it.